Hello, I'm John Bennett. I'm the CEO at Retinue, and I've got a very special guest here today.
Hi, I'm Simon Mawson. I'm Head of Resourcing and Talent Acquisition for Circle Health Group.
So Simon, thank you so much for spending some time with me today. Really appreciate it. We're going to go through a few questions just to really get some insight into your thinking around the resourcing and talent acquisition function. We've got some exciting things going on as well, so we're going to dive into that a little bit. Should we start at the top? And what's your vision for resourcing at Circle Health Group?
So, people are our biggest asset. So I think it's really important that when we're focusing on what our aims are strategically as an organisation, everything has to feed into our people. I think one of the big things that we wanted to look at was a hybrid of both permanent staff and flexible staff. I think one of the things in the market that we're seeing a lot at the moment is that trend of people wanting more flexibility. So for us, it was vital that we have a blended model that incorporates both employed contracted staff, but also flexible workers as well. And we really wanted a market-leading platform that would draw flexible workers to come and work for us. So I think that vital aspect of having a blended model was really what was our aim. So my vision is that we have a model that blends the permanent workforce and the flexible workforce together.
Excellent. So Simon, talk to me. How did it all start with Retinue?
For us, just linking back to the vision, obviously having that blended approach to our workforce, one of the things that we really wanted to look at was partnering with an organisation that could support us with that. We looked at a mixture of different suppliers out in the market, and for us, Retinue really stood out as being the model and the setup that we wanted. It had a lot more flexibility for us to control things, but most importantly, the leadership team at Retinue, when we engaged with them, were very transparent, very open about the market, and that was really helpful as well. And now we've got into service with Retinue. The team that supports us are really key as well, and that's shone through. And I think 2 years in, it's fair to say that it's a true partnership. Both sides of the organisations work really well together. It's almost you forget those individuals are from Retinue. We do site visits with our colleagues on site, and the service delivery team from Retinue attend site visits. And I often get asked, do they work for Circle? Are they part of the organisation? So I think that's just a real testament to the blended sort of approach that we've got as a team, and it works really well because it's seamless.
Has the MSP with Retinue been a success?
I would say absolutely. I think 2 years in, we've seen huge benefits with working with a smaller group of agencies, but with a much closer relationship. That's allowed us to really work closely with these agencies and they understand what we need and what we expect with Retinue's support. Also with the Retinue Bridge system, it's meant that all of the agencies are using the same system. Everybody's on the same terms, so everybody understands what everything from our perspective is standardised. The Retinue Bridge system that the managers use as well is really easy for them to use. I think tech in the current world is there's a lot of tech fatigue. So I think it's really important that managers have a system that works really well and is easy for them to use, and it is. And the block booking function is really useful for managers that have got regular requirements that need to be filled. I think the big focus for us was around working more strategically with our agency partners, and having a way to do that was really key. And then, of course, working more strategically with suppliers, with that smaller group of suppliers, it's more cost efficient and commercially makes sense for us as well as an organisation.
Excellent. So tell me, how does Circle Flex fit into this plan?
So I'm really, really proud of Circle Flex and what we've managed to achieve. How it links in with the vision that I had, going back to that blended model. We needed a really powerful change in the market from our perspective, and I'm really proud of what we've managed to achieve with it, because the big thing for us was around giving workers more flexibility. As I mentioned earlier, I think one of the big things that's driving the market at the moment is the access and the ability to access shifts easily, and that's ultimately where Circle Flex was born out of. We wanted to allow workers that wanted to work at Circle hospitals or services a really easy way to see what shifts were available, for them to understand exactly how much they were going to get paid for those shifts, and then also how quickly they could be paid. So the weekly model as a standard, but then the ability to take instant payments if they wanted. So you'll notice with everything that we've done with Circle Flex has been engineered to link back to that vision that I talked about, that I had in terms of providing that flexibility, because flexibility is often the biggest value at the moment in the market. So we're really passionate about giving workers all of the controls to make the decisions they want to about when they pick up a shift, if the shift's at the right rate for them, where that shift will be. It's all really in their hands and how they do it, and CircleFlex ultimately provides them with all of that ability. And then in the background of that and what sits behind it is our control, so we're able to make sure that those workers go through the relevant compliance. But the compliance element from the candidate's perspective is really easy for them to go through, because again, it's about that time aspect. The sector that I work in healthcare, we don't have desk-based workers. They're all, out and about on the ward or in theatres. So a really quick compliance process is really, really important, because they want to be able to quickly get registered, quickly see what shifts are available, and then arguably quickly pick up those shifts when they want to as well. But I think in the way that everything's digitised, now your expectation of when you're buying a sofa on the internet or whether it's booking a holiday, everything's really seamless and easy, and it should be the exact same for the shift when you're booking a shift. But one of the things that we noticed before we launched Flex is that wasn't really available outside of the public sector. So that's something that the NHS offer in their banks and the way things work. Within the private sector, that was quite unique and something that we hadn't seen before. A big thing for me is I always want to be first to market with things. I'm very much kind of the innovation and trialing things to see what the market will do. We're quite a bold organisation. You can see that from our branding and the things that we do and the way that we do them. So that links in really well to CircleFlex as well, because this for us was very new to the market, and we've had a huge uptake in interest because of that as well, because this is a new model that allows workers to have more flexibility, which, going back to what I said earlier, I think is power at the moment. So the mobile app as well for workers is really handy. It's available 24/7, so if they want to pick up a shift after they've finished a night shift or they're on holiday and they're anytime, they don't need to phone anywhere or do that. So that's a really big thing, and as long as they're compliant and they've gone through the compliance checklist, they can pick up a shift as soon as they want, whenever they want. They will get instant notifications of when they've picked up a shift as well, which I think is really important. So once that's booked and confirmed, they get notified through the app. And the same day payments is a really attractive model. So we find more and more now that workers want to be paid quickly for the work that they do. So the ability to pick up additional flexible shifts at a Circle hospital that is near you and be paid very, very quickly is a really attractive thing.
Looking at the benefits to the workforce, you've mentioned to me before that you feel there's been some benefits to well-being and inclusivity. Could you just tell me a bit more about that?
Yeah, so I think the big thing around employee well-being is that obviously these flexible shifts are available to our own staff as well. So our own contracted workers are able to register with Flex and pick up shifts either in their own location that they regularly work in or at another hospital within our group. And I think well-being is something that's really important to me, and I think providing people with the ability to choose when they pick up extra work, which typically sometimes in the healthcare sector it can be quite challenging over time and extra hours and the demands on the job. So I think having the ability to pick up shifts when you are wanting to yourself is a really important thing. And I think for me, from an engagement perspective, we originally piloted this in 17 sites to make sure that it was a service that worked well and responded well, and the feedback from the employed staff was so positive that they were able to have visibility. Because another thing that we hadn't realised is that when you're looking at bank work or overtime, you're relying on a manager releasing those shifts to those workers. And what we found when we piloted CircleFlex in 17 sites was a lot of workers didn't know that these shifts were available, because we were relying on quite old-fashioned ways of releasing shifts or telling staff about shifts. So having a platform that gives everybody a marketplace to pick up those additional shifts or work at additional location is really, really powerful. And I think, again, going back to what I was talking about around workers having some sense of control over their extra hours that they do, or if they are a purely flexible worker, the ability to control when and where they work, it's only going to have a positive impact on someone's well-being. Because I think when you're in control, you feel better than when you're being told when you work. And I think that is some of the stuff that we're seeing in the market as well. And some of the things that me and my team do is we look at those behaviours and feedback from both permanent staff, temporary staff and agency workers. The big thing is around flexibility and having control. So I think that will have a positive impact on employee engagement. We've seen that in 17 sites before we launched out across the group. And then also the feedback that we've had from purely flexible workers is that it's a really easy and nice way to do it, because it's 24/7. So they're not having to speak to somebody. They can do that out of hours. They can do it in their own time. They can do it in their own leisure. And the way the app works is it's really, really clear and obvious what the hours are, where it is, and how much that individual is going to get paid. So it's really, really important for me that we promote that element of flexibility for both our contracted staff, but also our purely flexible workers, because that for me only has a positive impact on people's well-being and their engagement ultimately in Circle Health Group. The more engaged they are, the more happy they are, the more they'll be likely to want to work with us in the future. And then from an inclusivity point of view, I think the fact that it's available 24/7, so no one's advantaged or disadvantaged based on the times they're available to access these shifts, I think is really key. We see that, from the data that people are picking up shifts at 8 a.m, 3 o'clock in the morning, 2 in the afternoon. There's lots of different times that you wouldn't, historically been able to pick up the phone and speak to somebody and see what shifts are available. So I think having the access through the app is really key for that inclusivity point, because we now know that lots of people want to pick up shifts outside of hours. So that's really, really important. But in saying that, there's still an ability to pick up the phone and phone someone 24/7. I think for me, one of the things I feel really strongly about is that there should always be a human aspect when you're dealing with people. So when you're dealing with recruitment, temporary workers, anything to do with human resources, in my opinion, there should always be a human element. So yes, there will be a multilingual chat bot that will allow people to talk in their native language so they're more comfortable in terms of understanding what it might be. But I think there's also the ability to pick up the phone and have a conversation with someone. I think for me, you need to give people the choice. So there'll be a lot of tech-savvy people that will know how to use an app, be very comfortable with going through a compliance checklist, will be happy speaking to a chatbot to narrow down what shifts they're looking for. They'll be really comfortable with that. But then there'll be certain individuals that will want to speak to somebody and understand a little bit more, ask a few questions and check things. And I think that's really important that we have both of those options. So yes, there's a really slick and seamless app, but then if you get stuck, there's still the ability for workers to pick up the phone and speak to someone, which for me is just so important.
Great, so look, fantastic. Sounds like the workers get some incredible benefits for Flex, and that is super exciting. But what's in it for Circle Health Group?
So for us, continuity of care is something that we're really passionate about. So making sure that our patients are looked after by a regular workforce that is known and trusted to the organisation. And ultimately, Circle Flex workers are part of the Circle family in the way that we all will support patients in their patient journeys. So having a mixture of flex workers, contracted workers in a department, they wear a Circle uniform. You wouldn't know as a patient they were any different. And for us, we treat them very much as part of the Circle sort of ecosystem in the way that we support our patients. Everything we do is obviously patient first, patient focused. So one of the things that, having a workforce that's super engaged, works flexibly, works permanently. And as I go back to my vision that I had at the start of this project, was having a blended workforce, and it ultimately feels like that for the patients, because they're not going to know who's a flex worker and who's a substantive contracted worker. That for me is only good for patient care, and ultimately that's what we're here to do. We're here to provide the best care that we can for our patients, and having a workforce that is engaged and bought into what we do, whether that's through a flexible model like Circle Flex, or whether that's through a substantive permanent role. They're not going to know, and that's what I love about this model, is that you wouldn't know going into a Circle hospital who was a flex worker and who wasn't. And I think for me, that ability for patients to feel comfortable, have that continuity of care with a Circle worker in a Circle uniform, is a massively powerful thing.
Great, so talk to me a little bit about your leadership style and how that has shaped where we are now with something like Flex.
So I'm a big believer in co-design. So one of the things I always believe in is that it's not one person or one department's decision to make for the rest of the business. So for me, when we looked at Circle Flex, one of the things that I said early on is that this needs to be agreed and engaged with lots of different people. So we engage with our operations teams, we engage with our clinicians, and we engage with Retinue. And we had a cross-functional discussion about what this service needed to deliver and how it needed to feel to those different stakeholder groups. So to our workers, to our operators that were booking those shifts, we made sure that we understood exactly what it was that they needed it to do. What was the problem we were trying to fix? We then piloted it in 17 sites to test the measure, make sure that it worked in the way that we wanted it to work in a safe environment. And then once we were comfortable with that, we rolled that out across the group.
So look, you've got me excited. It sounds like an absolutely fantastic product. So I guess the burning question on many people's lips is going to be, how do I actually become a Circle Flex worker?
So it's really easy. So if you register on the Circle Flex website, which you'll have on your screen now, once you're registered and you've gone through a straightforward compliance process, you'll be able to pick up shifts across the whole estate. Any of our services, both clinical and non-clinical roles, you'll be able to pick up shifts for. So if it was me, I would recommend to anybody who's interested in working for one of our services or one of our hospitals to register today, and we look forward to welcoming you to one of our services.